Let's bring in Dr. Payal Patel. She's an infectious disease physician, and she joins us from Ann Arbor, Michigan today. Dr. Patel, good to see you again. I feel like every time we talk to you, we're asking you about the timeline of a vaccine. Here we are again talking about Moderna CEO making these comments about the efficacy and where things stand on their trials. You've got a lot of people who are watching this saying, when are we going to get it? And you say that's not exactly where we should be focused on right now.
Yeah, I think, there's a lot of moving parts in approving a vaccine. And so instead of, I think, holding the feet to the fire on an exact date, I think that we need to continue to do all of the things that we're doing pre-vaccine, right? And so social distancing, masking, and then making sure that the vaccines are safe and effective when they do get offered. And I think that all of the companies that are making the vaccine will be trying to get this on the market as soon as possible. And so it's less about what's the exact date, but making sure that it's an effective vaccine and knowing that it will come out ASAP. No one wants this delayed.
Talk about the specifics that entails, though, for this vaccine to come to market. There's certainly a lot of skepticism around the rush to bring this to market, largely because there are concerns this could be politically motivated to meet that deadline that the president has talked about before the presidential election in November. So walk us through what are some of the markers that we should be looking for from these drug makers?
Yeah, I think, it's like separation of church and state, right? So you want to separate politics from medicine and vaccine development. And I think that, like other vaccines, such as the flu vaccine makers go through phase 1, phase 2, phase 3 trials all the time. And that's something that the FDA helps maintain and make sure that the vaccine is safe and actually effective for use once it actually is available. So we know that the companies have to adhere to some of these rules. It's just making sure that they are truly adhering to those. And from what we can see right now, the different vaccine makers are adhering to that. And that's why it's important not to focus on the timeline, but rather making sure that they are, kind of jumping through all of those hoops so that we as an infectious disease community, as well as the public, feel good about taking that vaccine.
Meanwhile, we still have 37,000 new cases a day on average over the last week across the country. We're looking at 17 different states that have now seen an uptick in the cases. What do we draw from that in terms of the regions that are starting to see an uptick, whether these are new waves that are coming in, whether it is just kind of not being able to bring down the numbers as a whole? Is there a particular trend? Is it because of schools that are reopening? Is it because of college students returning to universities? What are you seeing?
Yeah, it's really difficult, right? I feel like I say this every time, but a lot of things have not changed. We are in some of the same boat that we were a few months ago. Don't have a vaccine, don't have a cure, don't have a treatment for this yet, right? And so some of those same public health measures are truly the way to go. And the problem is if individuals are not able to follow that, you're going to continue to see ticks up and down until we can get a truly low prevalence. And I think that is not going to be able to happen until we have something like a vaccine. So it's really important to keep sticking to those individual precautions. And when you see different things cause people to forget about some of those, whether that's sporting events or going back to school, that's where we're seeing the ticks.
I mean, we are still seeing a reopening process underway, though, or continuing here in New York City. We've got indoor dining that's going to be beginning at the end of the month. We've got the city schools that were supposed to begin classes yesterday, still delayed in-person public school openings because of concerns around the virus. What are we learning from these instances where it has been a stop and go, or at least just a stop in the case of New York City altogether because of the virus? To your point, these upticks have happened because we have continued to push forward with the reopening.
Yeah, it's really, really difficult, right? So some of it is being able to what all the dynamics involved in something like school. It sounds like there's teacher shortages at play, as well as maybe an uptick in cases, as well as parents trying to figure out what is the safest option, what is my only option if I'm trying to work. So there's a lot of dynamics that we are not able to see until schools reopen, right? And so I think just trying from a parent or public kind of point of view, seeing that there's multiple factors at play and knowing again that there isn't a cure or a treatment yet. So we're going to continue to see these tactics and doing the best you can to protect yourself and your family with the things that we know work.
So what can be done? Short, we're not going back to the days where businesses are going to be closed. All the students are going to be learning from home. I mean, short of wearing a mask and keeping your social distance, what more can be done while we wait for this vaccine?
I would highly recommend to the public, we're coming into flu season here. And so one thing that we know works is the flu shot. I would highly recommend to your listeners to definitely get the flu shot, get your family vaccinated so that you can stay out of the ER, stay out of the hospital, and actually work on that one thing, because we still don't know how flu and COVID-19 are going to interplay. You don't want to be the unlucky one that has to deal with both.
And one other thing that I think's gotten a lot of focus, especially as we have seen the NFL season start, now you've got the Big Ten saying they are in fact coming back to play. You look at some of these spots where we have seen an uptick. It is a Big Ten area in the Midwest. What are your concerns as it relates to these sporting events as we move forward, in some cases having fans in the stands?
Yeah, I think that it's really difficult because, we understand that everyone wants things to get back to normal and enjoy the things that you normally enjoy at this time of the year. At the same time, we can't forget that we truly are still in the midst of a pandemic. And so if you are going to try and do some of these things that you normally enjoy, trying to do them in a way that you are trying to stay safe and contributing to the community around you. So wearing a mask if you're going to be outside. We know that in the wintertime, there's more colds just in general. And so knowing on top of that, you're adding the risk of getting COVID, thinking about those things and wearing a mask in, trying to protect yourself from all sorts of viruses, but still trying to, enjoy the things that you like to do.
Okay, some good advice there. Dr. Payal Patel joining us from Ann Arbor, Michigan. Appreciate your time today.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.